Hi, my name is Dr Marina Demyanenko. I'm a gynaecologist and fertility specialist here at Melbourne IVF. I did my undergraduate degree in biomedical science in Monash University and then did graduate entry medicine at Melbourne University. I did an elective when I was quite a junior medical student and we went to Vanuatu where I worked in obstetrics. We dealt with a population where they had issues with access to fertility care, but not even access to just fertility care, but access to basic contraception needs, basic like obstetric and antenatal care. And so it really kind of prompted me to follow that passion, that guide, to try and get a better understanding of what role could I play in this particular field, and is this something that I could really pursue long term? And then just really fell in love with it. I really loved the collaborative care that I think obstetrics and gynaecology and fertility really offers, well and above most other specialties in medicine. I think what really drives me and what drove me to fertility, I guess more and above everything else, is fertility preservation. So I have worked very closely with Associate Professor Kate Stern and Dr Jim Saltis, and they are both such massive mentors of mine, and that's what really got me into joining Melbourne IVF, but really what got me into fertility. And it really drove me to see what can we do better for our patients? What are we not doing as gynecologists that we can improve in our care for our patients? And what can we offer them? And that really drove me to look into fertility and trying to get more training and education, so that it was something that not only I could counsel my patients about, but it meant that I could actually treat my patients for that problem if it arose in the future. I really enjoyed the first consult. I love meeting the couples and just looking at their relationship dynamic and really just getting an idea of who they are as people, because I think that the rewarding part of this job and infertility and managing infertility is actually managing the couples. I really like to make it a very personalised approach for my patients. I really take that time in that first consultation to get to know my couple really well, because some of my couples want to really start very basic and they want to do some cycle tracking and some ovulation induction and try to make it as natural as possible to try to conceive. And some of my couples have been through this journey for a really long time, and so they just want to head to what's going to give them the best outcomes. If they have an ovarian cyst or a gynecological pathology, then I can manage that for them as well. And so it's kind of a one-stop shop, and I quite appreciate that, and I think my patients do as well. I try to be quite personable and quite relaxed and really get a good idea of what the people are about and what they're feeling through the consultation, and I try to really target my approach to what the patients feel like and what they're really wanting from the consultation. I feel like I'm a little bit of a warm teddy bear when it comes to my patients, but I can definitely put on my big girl pants if I need to. My big passion is really fertility preservation. So it's not just fertility preservation for my oncofertility patients, so my patients that have got cancers or significant medical conditions where they're taking medications that will affect their long-term ovarian reserve. My patients that are choosing to preserve their fertility for themselves, not because they've got an underlying medical issue, but because they want to empower themselves to make choices that are educated and the right choices for them. Fertility science is this ever-growing and developing profession, and I think we're always developing new techniques and new ways to help patients with their fertility journey. At Melbourne IVF, we're really lucky that we've got Professor David Gardner as our scientific lead in our department, and that part of Melbourne IVF, we're driving innovation. So it's not just about us and your fertility journey initially. We do so much research in the back to make sure that we're developing and innovating and doing all of those things that will improve outcomes in the future as we kind of go further along this journey. I'm an avid cyclist. I actually cycle to work every day, and I get told off by all the other fertility specialists about the fact that I cycle to work every day. It gets me out of the office and it gets me into fresh air, and I really love being into fresh air. I also rock climb, so I do a little bit of indoor rock climbing, but I've also done a little bit of outdoor rock climbing, which I really enjoy. I like being outdoors. I like not being stuck inside, so going out for coffee with some friends and some brunch and just hanging out with my family and friends. I find my family and friends are super supportive, especially of the fact that I work really long hours. I think the most important thing, and I think that the thing that we forget when we're on the fertility journey, is what's next and what's the next step, and we forget to look after ourselves. Take that time, look after yourselves, because you're just as important.